just do your chair. If you want, you can start recording, or do you want to like take your gloves off for a second? So I think because I'm sitting here and I'm this tall, so you want to be like maybe. Hey, can someone help Tanya how to adjust her chair, like so that she's in the right position compared to me?
Yeah.
So do you think she's the right height now, or should she be?
Yeah, that's better. So she's about 10 centimetres higher now.
Yeah, because she was lower than me because I put the chair up a bit.
Your knees are a little bit more. Yeah, bring that in as close as you can. Yeah.
I think always asking to come closer, or maybe especially Tanya, just like maybe we try
A
this
bit more to the side.
to that side, or
Knees this way.
like swing like that, maybe.
Yeah, that's it.
Okay. All right. So are we gonna just like work through this one? Yep. So Tanya, because like I guess Tanya wasn't at the other course, so this is just like which instrument we're gonna use, and this is like the instruction what to do on each step.
Yeah.
But I think they don't have the rubber dam out, so you can ignore the part about rubber dam if there was something.
Now,
So
Tanya, yeah, hold it from the top.
this one,
Yep, from the other end.
I think she wants you to hold it like that,
Yeah, that's
so
it.
that I have to grab it like this.
Oh, like this.
Yeah.
Yeah.
Oh, yeah.
And then if you can come closer, like if your hand can come closer to me so that I can reach.
Bring
Yeah.
your elbows off there. And
Yeah.
reach. Sort of
Is that okay to ask her to come that close?
Mhm.
Yeah.
Yeah.
Yeah, you can let go now.
Yeah.
Yeah. And then
see,
normally
what I
I'll
would
do.
think with that
I'll just
chair,
not put actual.
I'd like your bum a bit more in the middle of the chair because I can see that you're feeling anxious.
Put your bum back a bit.
Put your bum back a bit.
And I
That's it.
I know
Yes.
Kathy says both feet on there, but I have 1 foot on the ground. I like 1 foot on the ground.
Then that's when if we can adjust that belly bar, we would bring that belly bar in a bit closer to you so that you can really sit flat on the chair. Yeah.
Yeah, maybe
Up
I'll
to
get
you.
the technician out to show us how to
Yeah.
do
Up
that,
to you
or I
with
can
your
ask
legs,
them.
but that's just me. I like to.
Or maybe Anna, you can ask them if how to do that. Yeah, you were doing it right. You had the probe.
Take it with your little finger.
Pinky.
That's it. Good.
Yeah.
Excellent.
And
That's
then,
it. And if you just, as a clinician, remember you can keep your finger rest on the actual chin over here. So we want you to stay here.
Yeah, and you can leave your finger rest there and just tip out your hand.
or like this.
Yeah, rather than
Instead
moving
of
your
trying
hand
to
out.
give it to the DAs.
And then what does it say? Triplex suction. Oh, and then we're supposed to be doing local anesthetic, and then we'll just pretend. So we'll do LA first. So I think put that back. Maybe we can.
I'll bring it over.
Yeah, so
Okay,
do the
let's
LA first, then rinse off the LA.
So you can give me anesthetic. Just pretend you give me typical already or something. But yeah.
Right underneath the patient's chin. So
And then pretend.
you good to go, Winston?
Yeah.
Yeah? We're going to go, Sheila?
Okay, and then if I'm giving her back, would I like, because I wouldn't give it back to her. I will
No,
just,
then you
normally what I
take it.
do is like if I'm using the traditional LA, like the syringe,
Yeah.
I would take it and then I'll like take off the lid and do
Yeah, sure,
everything myself
that's fine.
here and then put it back on because then I've already got the lid over here.
Mhm.
But I guess
you
if
were
they take the
doing-
lid off for me, then I'll just come behind the patient and go like that and put the lid
That's it.
back on.
So normally what we do when we
Mhm.
teach our DAs is that we'd have a kidney dish there with the syringe in
Yep.
it. So they take the lid off, put the lid in the kidney dish.
Yep.
Then you inject, then you go back
Yeah,
to the
we
kidney
have some
dish,
little
recap.
like container.
Little
I call
container,
it a
perfect.
sharps container, but we just have like little plastic. Yeah, that we put.
Yeah,
we're doing
perfect. So the DA can put the lid there and then you can go back. So then it's
Yeah.
not here as
Yeah.
well, it's back over there.
Uh-huh.
Yeah. Now
Okay,
you
do you
would
want
get
to
your
practice
suction.
that? So do you
Yeah,
want to
do
practice
this
giving
again.
it to me and then you passing it to me? You did it right.
Oh.
No.
No,
So
holding it in your.
You gotta
So
hold it
hold the
like so
barrel.
that I can get it. So just think about how I'm gonna
Oh,
hold it, and then so you're gonna hold it from like here.
Mhm.
So you hold it from there, and then wait here, and then you're gonna pull off the lid, the whole lid. So that's just we keep that so that we can like dispose it properly. So you pull from here where that top sticker is, like that.
Okay.
And the reason that you can do that is because I haven't already injected the patient. So if we already used the needle and we will say you're going to use it again, then you don't do that because then you might get hurt. But if it's the first time, like say I'm doing that and you get poked, it's a new needle anyway, so nothing's going to happen to you. Good. Yeah. And then you put it there, just pretend we've got a little tray dish, and then your patient's got very stiff lips.
Good, good. You're
And
reaching
then-
for the suction, go for it.
Yes, okay, good.
That's it.
And then you can practice rinsing if you want, like you can triplex there now.
Yeah, go for it. You
Should
know,
we put
this
some more?
patient, all right?
Put some more.
Yep, switch your suction on.
So if you do both at the same time, you get the spray.
Mhm.
So if you do one, it's water or it's air. But if you do them both together, then you get the spray and it rinses the so you can like put your thumb on two of them at the same time.
That's it. That's it. Good work. Nice suction patient. Good.
So, and just rinse the teeth. So just if you're using the phone, that's really of the teeth. Normally I rinse their tongue because I think that's what she was trying to do before, actually rinse their tongue because it doesn't taste good.
Yeah.
Practice doing the spray with the air and water together. Yeah.
Right in the middle.
You're going to be try to use your thumb, it's much easier, and push them both down. Maybe you can practice later, just like checking.
Yeah, just bring those
Like
over the other way. So, yeah, through there. Yeah, that's it. You okay with that?
Yeah.
Are you okay with that?
Yeah, that's
So
okay.
there you go. Yes.
Maybe like this so it doesn't go on her leg or yeah. I think that's okay. Like it's not really touching anything.
I found that it sat nicely on there. Yeah. Sometimes they really loop over too quick,
Mhm.
too fast.
And piece.
Yeah.
And this one.
Even
You
with
can
that,
put it
even with that, you can come right down.
Yeah, it's much easier for me like the closer you are because if you're all the way over here, then I've got to like lean
Yeah.
over.
So we're avoiding any
You can put it.
extra reaching. You see what we mean? Yeah.
Yeah.
So once I've taken the burr, then you can just put it back straight away. And then just we'll pretend. So if I've got the handpiece, I'm going to use suction so you can put that throat back. I'm not reading this story, so I might be making it confusing for you. Yeah. Good. Okay. Oh yeah, and then it was saying swapping between handpiece and throat, like in case I got to check it, I guess. So then you can. How does
Suction
she?
down? Yep. There, and then grab the throat. Actually.
And then you want to like swap with me.
So with that, hold that in your finger and your thumb
Will you saying that I keep my
Use
finger
your-
rest here
yeah,
and
yeah.
just hold it?
and pull your 3 fingers out.
So
You're
you
gonna
need to come a lot closer.
Yeah, that's it.
Yeah.
That's it.
So
Okay,
don't be
stay
scared to like
still.
come and touch my hand. Because I'm always telling them, oh, don't touch my hand. But if I'm not like physically drilling or something, you
Yeah,
can
that's
touch
good
my
to
hand.
know that, yeah. Good. So when she's finished, she's just going to indicate. You're going to
So
take
if
it
I
with your
go
finger
like
and
that, yeah, then you grab it. Yeah. And just make sure to drop this, okay?
It is a bit of practice in your hand.
Yeah.
I can probably make it look really easy, but I've been doing it for 30 years, okay? So it is a bit of practice, all right?
Yeah.
Hand will get better
And
at it.
then what's next?
Edge.
Okay. Normally we would do like matrix first, but I guess it's not. Yeah.
And if you're not left-handed, it's hard for your left hand.
Suction.
So normally what happens here is I'm like doing the edge and then they're over like looking for the suction. So I go like that. So should I like etch and then give it back to them? And they, if they put the suction here, then they don't have to be like,
Yeah, that's right.
for it.
Yeah, that's right.
We could put that back yet. Should the DA rinse the etch off or should I rinse it off?
It's totally up to you what you want. As part of their scope, they can. So it's just a matter of practice and what you prefer. With the drying, it's more of a optional, more that the dentist would prefer to dry.
Or if I'm going to dry, might as well.
Yeah. So that's a technique that just takes a little bit more practice. But
I think rinsing like full mouth rinse at the end of the DA should do it, but maybe with the etch I'll do it just
yes,
because
absolutely.
it's a bit like
It's totally up to
how
you.
you want to do it.
Totally up to
But
you.
you didn't have to actually put real bond on it, but that's okay.
Yeah.
And then would I give these back to her or check it on my side?
She can take that back.
So, mhm.
Good. So when
And then
yeah, so even before you picked this up, can I just go back for 1 sec?
Mhm.
So you had that, you know that the edge, you're going to put the composite next, yeah? So
Yeah.
if you take that back, and then if you know that she's going to use the flat plastic,
Mhm.
you'd pass that and take that back. That's
so
first.
pass it to me like in a way that I can get it.
So if you go like more like
You
this,
sure how to pass?
yeah, so if you're holding it like that, you've got your little finger ready. Little finger out, just your little finger.
So like that, like
yeah.
you're drinking tea, fancy like.
Yeah, that's it.
Yeah.
Okay. And then now grab this. Away you go. She's just going to hold.
Oh,
that
and
there
then
for
I'm
a sec.
just waiting
Yeah.
here until she's going to give me a composite. That's good.
It just saves one.
Also, I'm a bit different than because I know everyone uses flat plastic first. So me, I use Westco,
Yeah.
and then I'm not actually doing it, but just so
Yeah,
I teach
no,
them
that's
right.
good. Yeah.
I usually use Westco first, and then when I'm finished with Westco, I probably use the Hollenbeck. And then I'll use the probe after. But sometimes I'll use flat plastic more if it's anterior. Or
Because you know that you're going to use that again in a minute, you can
can
always
put here.
just leave it there.
Oh.
Yeah. Perhaps just leave it there.
And then with the composite, I usually get them to, so what we do is we have the composite on the mixing pad,
Oh yeah.
and then I get them to hold it and keep it steady with their thumb, and they cover it like that with the dappen dish.
Yeah.
And then bring it over, and then, oh yeah, Tanya can do it, like she's not like she doesn't know. Yeah. And then I'll like take the composite like that, and then she'll cover it again. And then she's already holding this, so when she needs to like do it, she can just. Yes, that's right. Cause see, you're right. They remember because I didn't remember cause was next. You know.
Good. That's their job.
But I'll know if I'm like done with this, and then the gauze isn't there. I'm like, where's the gauze?
Very normal for a dentist to do that.
Okay. So now we might practice swapping like with Hollenbeck or half Hollenbeck. Yeah. And just and then don't put it back. Maybe you want to like keep it, and we'll just like practice like changing over instrument a few times. And then, do you want to show her again like how to walk it? So, is that okay if she just
long as-
let's swap and I'll just show you.
If you keep your hand in as well, so just
Oh,
stay,
sorry,
yeah,
I
that's
gotta
it,
stay
and
here.
just like that. So remember now, what you're going to do, just take that out, hold it like that, have your little finger out, yeah. And now you're going to take that like that, go in, and she's going to
And
take
I think
that.
she found it easier to use her other hand than use it like she's using two hands to like I don't know. I just saw her going like that.
Yeah,
Is
up
that
to you.
okay?
As
if
long
she can't,
as
like, walk it,
as
or-
long as you're getting that same working end, that's the priority, and it's safe. Okay, you don't have to do it my way. As long as you're giving her the end back that she wants, we don't want the clinician to have to turn that instrument.
Mhm.
Oh, and
You know what I mean? Yeah.
while we're on that topic, if I'm using the Westco, I'll always use the small end first.
Yeah.
I don't often use the big end. I mostly just use the small end. So if you
that-
put
is
the
that on
small
your-
end
is that on
pointing
your
towards
sheet?
the mouth, no, probably not, but it's going to be on the
Add
video.
that on the sheet, yep.
And then with the going back, I probably would use that end first. I don't know, what do you call that?
I don't know, it's the pointy end, I suppose.
The end that's like going the same way. It's not like perpendicular or whatever. I don't even know what you would.
Spoon, I don't know.
So I use this end first in Hollenbach, and then this end I'll use it when I'm more getting up to the occlusal area, or the interproximal. Yeah.
Yeah, you could just say that.
Never thought
That
about
end
what the
first.
different ends were called.
Or, I don't know either.
We probably
They
learned it.
probably
I
don't
probably
even have a name, do they?
I don't know, probably. Yeah, so I'm meant to stay here, and then so if I use my instrument, Tanya, and then like
And then
I'm
she's
done
just-
with it, I'm just gonna
she's
go
just gonna
like that,
indicate
and that
like
means to you, I want to swap, so you have to come all the way over here. That's why you should be sitting a bit more.
Yeah.
I don't know.
And yeah, just like that. And then you're going to come in there.
So is she
That's
in the right like position?
Yeah,
Sitting
you
position?
just might have to move, yeah.
Or
Move
just
your
lean a
body
bit.
a little
Okay.
bit like that as well. Yeah.
Okay, what's next? And then we might get
That was a good,
oh,
that
we
was a
forgot
good
floorball,
right?
Horrible.
and then
It's
no, we forgot. It's okay, don't worry. Then curing that is next, I think.
It's hard to focus on it all, but yeah.
I'm so like, I don't know. I'm like, I want to adjust her light to the
Yeah.
tooth that I was pretending to do, but even though we're
Yeah.
not really doing it.
So if it's the, yeah, so
I
you
think I
just
was
have to
doing
turn
one.
that like that.
Mm-hmm.
Do you get them to do a collusal and do all the surfaces
Yeah,
of it?
sometimes I'll be like, oh, okay, so now do palatal. But I usually, if it's like Shina, I'll get her to do it. But if it's Tanya, I might just like hold the light in the position, or I might.
And once you get to know sort of all your surfaces really well, then you just sort of know you do the occlusal first, you do whatever surface that you like.
And even with the suction, if they're going in first, I might just be like, oh, I'm doing 2 6, and then they can like put the suction
Yeah.
where I want it.
Yeah.
Okay. Articulating. Normally, I actually maybe for the like if you're gonna edit this, I normally would do before articulating paper, I would actually do a bit of polishing first and then articulating paper. Oh, I was supposed to give you this one. And then maybe like Tanya, you can pretend to do the articulating paper, so the dental assistant can also do articulating paper.
Mhm.
So I don't know if you have any input, but normally I would say like hold it to the upper teeth and just line this the like nose faucet up with the just the on the buccal side, so they don't want to bite on the metal, they just want to bite on the paper, but the whole paper has to cover the whole teeth, if that makes sense.
And that yes. So
And
that,
always line it up with the upper, even if you're doing lower teeth, you can line it up with the upper. Like, so if, say we're doing this tooth, or say we're doing this tooth, so you can actually see, I'll still put it here and tell them to bite, because they're going to move their bottom jaw up, they're not going to move the top jaw down, so this jaw will always stay still. Otherwise, if you put it here, they bite, they might end up like biting on the metal.
Mm-hmm.
yeah.
So this part here, and then
Yeah, that's good.
they bite.
Yep. You just like bite up and down, pull on the paper, and then you can just practice the other side. You might have to use mirror.
Yeah.
Yeah, that's good. And you can just put them together.
Yeah. So then
Or
if
the
you
other thing that we would do is like if I'm going to do the paper, then you'll be holding the paper and I'll be holding the handpiece, and then somehow we're going
so
to
you're
swap.
you've got this triplex in there as well. Yeah, that's it. Like that. Good. Suction on in there. Yeah.
Feels
that's
like,
it.
you know, when you go grocery shopping, you forgot to bring a bag. You carry it.
Gotta carry it down.
Okay.
So now,
And then
now you just switch that off. I'll bring that triplex into this hand now. Hold it there like that.
Mhm.
Hold both of those. Yep. Now go in with that. Oh, sorry, you're going to do
And then
so
we're gonna
three
just-
fingers again. Three
So-
fingers. 3 fingers.
Yep.
Okay. Tanya? Yep.
Mhm.
and then I'll be like, right on the paper, and then
Take it with you.
you can take this with one finger. That's with 3 fingers because it's
And
heavy.
keep that. Yeah. Keep that like that. So you would just take it like that.
Oh, sorry, this is different.
Same
yeah.
thing again. Yeah,
Yeah,
same
so that's
thing.
with thumb and
So your finger and thumb will just stay there, and that'll take the
and then
instrument
you would have to like suction.
back. Is it back in again? Yep. Yep. Try and lift that instrument up a little bit so it doesn't bang the other one. Like hit into
You have to
it.
come and get it. So if I'm with the
That's it.
patient, like I can't be like, you have to come and get it because I'm gonna be like, come closer, come closer. What should I say?
Come and retrieve or
Or
something.
should
like
I just
that.
say, or like
Just have some pet words or
touch
something that you.
my hand, or I don't know what it was. Retrieve.
Yeah, retrieve maybe or.
Yeah, because she might think I'm just checking. She might not know that I'm trying to give it to her if I just move my wrist like that.
That movement.
Yeah,
But ideally, you've got to be looking.
but I
at
find that if I
movement.
say it, like sometimes before I want something, if I say it like 5 or 10 seconds before, then they kind of ready.
Yeah.
So would I say like, or even if I just say articulating paper, and then she knows I
that's
want
right.
to swap.
Exactly. Yeah. And this is why we like to practice this with mannequins.
Or you can
So-
use
so
those
those-
fingers.
yeah,
or
so
something. So
when you
you're
take
holding
it-
with these,
And keep that finger and thumb ready to
And then,
retrieve.
yeah.
And then, Yep, that's it. Good. Now keep your finger and thumb there. Good. That's better.
and then can I just go like that, or do I have to like?
Oh, not really. She should just be able to, come into it.
Yeah,
As long as it's safe for everybody, that's all. Yeah.
Yeah,
Good. You start to maneuver your hand to move it
yeah.
a little bit
Okay.
more.
Yeah, I think we probably practiced that enough. And then now what? I guess we're. Oh, you can practice full markings now.
We're starting midline on the top, midline down. What's it like?
So you
Midline.
start from the. Can I do it and then you do it after, so you can watch me? But, I mean, I don't know if I'm.
Yeah, that's nice. Absolutely.
So pushing both button at the same time. You have to press really hard or it won't. So Tanya, you got to push them both down. So just put your finger right in the middle with your thumb, and then so just go like over the occlusal, but wiggle it around a little bit so you get the size. I got his tongue. And then what did you say, midline down always? Okay, so where do I want to be holding my suction when I'm doing this? Because normally there's someone who's
So the clinician might just go like that,
Oh, okay, yeah.
and that makes it easier.
Okay, you can try, and then I might look up.
Yeah.
Yeah. And you can always keep the patient's head to this.
As well as then doing the right side. That's what we do.
Try to get them both at the same time. Yeah, it is. And you can go a little bit closer as well. Okay, I'll retract for you. And when you're doing upper, just aim it at the upper, and when you're doing lower, you can aim it at the lower, yeah? But you're aiming for like the occlusal, so that you're sort of,
Try not to go too close to the tooth because it will spray.
yeah, especially if they were doing, like if we're doing a filling or something and there's like a cavity prep there, and then you spray straight into it.
Yeah.
But I find that it splashes less when you've got it on the spray setting than if you've got it on the just water. It So it tends to
yes,
splash more.
yeah, absolutely.
Okay.
Good, how do you feel?
Yeah, I think I need more practice.
Look, you do, absolutely. It's very normal. Like, it's, but as you slowly get used to it, as a team, it will be good.
Or you can just, we put the rubbish in the sink and then we'll put it in the bin after. Or if you give it to Tanya, she can put it in the bin. The bin's all the way over there.
Yeah, our mannequins at the